Welcome to Health in Retirement. Each week, we'll discuss some of the health challenges facing retirees. We'll focus on more than just physical health. We'll look at financial health, mental and emotional health, as well as spiritual health. With your host, Rebecca Jones. This is Health in Retirement.
Hi, I'm Rebecca Jones with Health in Retirement, where I want to keep you informed and up to date on everything to do with your health in retirement. Everything holistic, mental, physical, and spiritual well-being, and yes, even financially. Today we have with us Amanda Haworth. She is a nurse practitioner. Thank you for joining us today, Amanda.
Thank you for having me, Rebecca. I'm happy to be here.
Absolutely. I really wanted to get you in here today to kind of give our listeners some valuable information on what is out there for them in aspects of their health and what exactly you can offer them. I met you a few months ago, and I was like, you would be perfect to have on our show. You are a wealth of knowledge. So just tell us a little bit about what you do.
Okay. So I currently work with women only, helping them with their mood, anxiety, thyroid, and hormone imbalances.
Which is big.
Yes,
I mean,
is.
That is the root cause of a lot of things.
It is. And I do the thyroid and hormone imbalance too, because a lot of times that plays a big role in their mood and anxiety disorders. And I think it's important to get to the root cause of what's causing the mood and anxiety.
Have you found with, as women age, is there a bit more of this hormonal imbalance?
Yes, there definitely is, especially as women age and go through menopause. Their body no longer makes a lot of the hormones that they once made before. And there has been such controversial information put out about hormones that women got scared or they didn't need such hormones, even though the body made them.
Oh, like estrogen
and
or
testosterone.
Oh,
and testosterone's a big one. Women didn't.
They're scared of it. It's
they
like,
are.
You're like, oh no, not testosterone, but we
Right.
need a certain amount.
Yes, and your body actually makes that and converts it to estrogen. And so if you don't have enough of that, then you're not going to make the estrogen
that's
you
necessary,
need
right?
in order to balance out your hormones and then your mood and your anxiety in addition to it.
And that also affects your bones as well?
It does, because you need estrogen, a certain amount of estrogen for bone strength.
Exactly.
Yes.
So, what kind of got you in this field? Like, why is this your passion with women and anxiety and depression?
So I've always wanted to work with women since I was younger. It's always, I don't know what it was. It's always been a passion of mine. But then the more I worked with women in the clinic, the more I found myself being drawn to helping them with their mood and anxiety. I saw there was such a great need for it.
Right. There's just like a lack, I feel like, in a lot of ways. So many doctors, you go to the doctor, they're not really listening, and you need someone on your side that really cares about what you have to say and what, the symptoms that you're feeling, and you're there to listen and hear them.
Exactly. And that's one thing that I really focus on. My appointment times tend to be longer, so that I have time to really listen to my patients and find out exactly what is going on with them. So instead of the typical 15 minute appointment that you have with most of your providers, my appointments are 30, 45 minutes long, just so that they can get out everything that's going on with them, so I can get a full picture of what's going on.
Exactly. And, I've been in and out of the healthcare system myself, and I've always hated that I felt kind of like a number, and they were just, I would say, well, I am feeling this, or I'm not sleeping anymore. And they'll just like, well, I'm like, well, I'm taking Benadryl all the time. And they're like, yeah, that's fine. They don't really sit and care and listen. And they just kind of want to cover it up and not get to the root cause.
Right.
So what are some of the warning signs that someone, maybe it's depression, or maybe it's anxiety, or maybe they don't know if what they're feeling is a hormonal imbalance? What are some of these symptoms that...
Yeah. So a big one is sleep. If you are not sleeping anymore, that's a big thing. You're going to fall into depression or anxiety. If you're not sleeping. Your brain is just a big muscle. And if it's not getting rest, then you're not going to be able to cope like you need to.
Right.
And that's a symptom of actually all three: hormone imbalance, depression, or anxiety. If we're talking about depression, other symptoms of that are lack of concentration, not wanting to do things that you used to like to do.
Right.
So,
just not having the desire to
try. So, and then it usually turns to where you don't want to get out of bed. You're not taking care of yourself. You're not eating. And then you start to feel guilty for everything. You feel like everything's your fault. Right.
And I think it's one thing I want to bring attention to our listeners. If you have a significant other, these are things, maybe you're not listening for yourself, but maybe you can listen for your significant other. Yes. And help them be proactive in their health, and help them, if you're noticing the signs of your partner and they're not sleeping or whatever, maybe bring it to their attention. Hey, maybe we should get some help. Let's be proactive in this before it gets worse. And so tell us a little bit about your background, because you haven't always, done this type of work with depression and anxiety and stuff. What's your background look like?
So I have a wide variety of nursing background. So I've been a nurse for 17 years, and I've worked in various small hospitals, medical, surgical, ICU, ER. I did some hospice nursing. I taught nursing for 4 years, but the last 7 years of my nursing career, I worked labor and delivery and pediatrics.
Wow, you have definitely been across the board. It feels like in all of the aspects of the healthcare system. I have a lot more questions for you, and I can't wait to get into it. I feel like you just have a wealth of knowledge to give to our listeners today. So we will be right back after this with Amanda Haworth, nurse practitioner. Hi, and welcome back to Health in Retirement. I'm Rebecca Jones, and I'm here with Amanda Haworth. I just want to, again, reiterate, it is so important for you to be your own health advocate. Your health is your biggest investment. So we should treat it like it is. Be aware of what your body is feeling, what's going on inside of it, and if you go to a doctor or a practitioner and you're not getting, you feel like the care that you deserve, or they're not listening to you, get a second opinion. That's okay. And that's why I have Amanda here today. She takes the time. She wants to listen to your needs. What is going on with you? Get to that underlying cause, get to the root cause, and don't just treat the symptoms. Well, here's some Tylenol, right?
Absolutely.
And as you were mentioning your work history, I was pretty interested that you were in labor and delivery and did that. And I assume after that care was maybe you work with postpartum a little bit with women.
Yes, I did. I did the postpartum. So the labor and delivery unit was all together. So I would follow them to the postpartum side after they delivered. and take care of them there. And that's really kind of where I think the passion to help with the mood and anxiety disorders came in. Because so often I would see, especially new moms, struggling with just learning to become a new mom, but their anxiety would get so high. Even second and third time moms that had struggled in the past with postpartum depression or anxiety.
Do you feel like, so I have 4 kids of myself. I've been through the birthing experience, and I've had some of my friends tell me their experiences as well. And sometimes, I mean, that could be a very traumatic event. And especially if you're not having that care and support in the time after you have the child and you have this postpartum depression. And, you know, if eventually your body remembers those things, and if you never seek help, you could be now of retirement age, and then you're still kind of feeling this depression and traumatic events from the past.
Oh, absolutely. Any type of trauma that you go through that you have not processed or gotten help for is absolutely going to lead you to dealing with depression, anxiety, and until you take the time to process it and seek help for it, it's going to burden you.
And, you know, now I'm thinking, I mean, postpartum, even, you know, 20 years ago when I had my first daughter, like, it wasn't even a very like advocated for, or there wasn't much help. So could you even imagine, you know, our parents and our mothers, they didn't have any support, or there wasn't a thing, you know, when was this? I'm kind of curious now, when was this term postpartum depression, like, even like give recognition to the women going through this situation, right? I mean, I don't even think it was.
Right. So the diagnosis has been around, but there hasn't been a big push for recognizing it until recent years, probably within the last 5 to 8 years. There's been a bigger push to give women the support that they need.
Right.
In all areas of mental health, because it has been so underserved.
Yes. And I mean, so many times it's just like, well, she's on her period, or she's, you know, she's just being hormonal, or da 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 da. A lot of times women's health is very like kind of pushed over and glazed over.
Absolutely. And I know I've had several women come in, and that's what they would say to me is, well, I've gone to so many other doctors, and that's what they would say. And especially my older patients, they would come in and they're like, I've been going to so many providers. And I had this one, she came in and she was suffering from severe depression and anxiety. And she's like, nobody would listen to me. And I was in the room with her for over an hour because, one, that's what she needed. But in order to get to the root of all of her causes of what was going on, that's what it took. And she was so grateful just for me to sit there and listen to her and actually listen to everything that was going on with her. And it was a hormone imbalance that was causing all of it.
Right.
And once I got that balanced out, she was so grateful and felt so much better.
Yes. I think just to be heard and listened to, someone's actually listening to what you have to say, what you have going on. You know your body better than anybody else. You've been with your body your whole life. So listen to, follow that gut instinct. And talking to a provider, find a provider like Amanda that is going to value what you have to say, listen to your symptoms, and try to find that root cause. Would you give any advice to women? You know, what are, you know, what's the key thing other than sleep? Is there any other hormonal imbalance symptoms that they could be aware of?
So the other big ones are having trouble losing weight. That's another big one. And then changes in your mood.
Right.
That's
Which
not
can be
normal.
Yeah. But society has normalized it.
Society's normalized it, but it's not normal. You being irritable all the time is not normal.
Right.
Struggling to lose weight when you're dieting and stuff is not normal.
And maybe holding it all around
the waist
Yes.
is the biggest thing. Those are all signs of a hormone imbalance.
So if you feel like you can resonate with what is being said here today, how can our listeners possibly get a hold of you or see you?
They can call my office to schedule an appointment, 316-866-6291. They can go to my website, haworthhw.com.
And this is Amanda Haworth with Haworth Health and Wellness, nurse practitioner. And if you have any questions, feel free to go to our website, healthandretirement.com. You can put your questions there. And thank you so much for joining us today, Amanda. Really appreciate it.
Thank you for having me.
And we will be right back with Cory Hiebert with Market Medicare Advisors.
Now, our health tip of the week.
Hi, I'm Rebecca Jones, and this is your health tip of the week. With May being Mental Health Awareness Month, I wanted to bring you a few tips to stave off cognitive deterioration. Your brain is like a muscle, so anytime you work out, it is also good for your brain. And that also means learning. Never stop learning. Challenge yourself. Pick up an instrument, learn an instrument, learn a new language. And did you know that your brain consists of 80% of water? So this is me reminding you, drink your water. And also don't forget those really healthy foods like avocado, blueberries, walnuts. These are brain foods. Another really good way to challenge yourself is to, when you brush your teeth, brush it with your non-dominant hand. This challenges the brain to work and be challenged and grow first thing in the morning. And these were a few tips to slow your cognitive deterioration. And this was your health tip of the week.
For more health tips, go to healthandretirement.com. This has been your health tip of the week.
Hi, and welcome back. I'm Rebecca Jones with Health and Retirement, and I'm joined here today with Cory Hiebert. He is our Market Medicare Advisor. We can't talk about health in retirement without talking about Medicare. It goes hand in hand, right?
Yeah,
so,
absolutely.
Welcome, Cory. I do have to say, I went to a lunch workshop that you were holding, and I didn't even realize how much information there is to take in with Medicare. And you are a fountain of knowledge when it comes to Medicare. And so I learned a few things. So I did have a few questions, if you wouldn't mind answering those for me.
Yeah, well, those lunch workshops are great. They're a really good way to kind of start that Medicare discussion. We only run those for an hour, and there's a lot to talk about when it comes to Medicare in general.
Yes.
And even specific circumstances that you're under. So I try to get as much done in that hour, but of course people do have questions. So what did you come up with?
So one of the people, actually it wasn't my question, but he brought up a pretty good point is, what if you have moved? So you're in Medicare and maybe you're going to move in with a child, or a caregiver out of state, or you're just moving and, maybe it's time to go to Florida, for retirement. And how does that affect your Medicare?
Yeah, absolutely. That's a great question. There are certain Medicare plans that are completely dependent upon your zip code. For example, if we're on a Medicare Advantage plan, those work in networks with networks of doctors. So if we do move or change addresses and change that zip code, we've got the opportunity to make a change to our Medicare Advantage plan, even though we're not inside the open enrollment period.
That can be a bonus.
That could be a very big bonus because depending on which area you're in, some Medicare Advantage plans are just have better benefits than others.
Right.
The other big thing is that if we are moving, you do have the opportunity to change your prescription drug plan. Your prescription drug plan does rely on your zip code. It's not mandatory that you change that right away, but as soon as your information gets updated with the Social Security office, Medicare is going to come to you and say, hey, why are you still on this other plan? You need to be on a plan for your zip code.
Okay.
So yeah, it is important that whenever you are moving, you're paying attention to what is offered in your area.
So if you move, it might be just a really good idea to go ahead and see a Medicare advisor, make sure that you're on the right plan, that you can get re-enrolled in the network. Is that right?
Right, absolutely. And it is good that if you are working with an advisor and we move from state to state, it is important to know that where your insurance advisor can sell, because we are required we are contractually obligated in certain states. Here, I like to hold several states. A couple of the ones I do would be Kansas, Missouri, of course, Virginia, Florida, and Colorado. Those are some places where I've had clients move in the past, so I like to be able to help them.
That's awesome. Yes. So you're there with them every step of the way, whether it's move or a health issue, you're going to be there. You're going to be their advocate, making sure that it's going to best fit them. And how can they get a hold of you?
Yeah, you can reach us at 316-867-4MED. That is 316-867-4633.
Thank you so much, Cory. I appreciate you being on here today. And this has been Your Health in Retirement, where we care about your biggest asset, your health.
This broadcast is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers and not necessarily those of Foundations and its affiliates. The information contained herein does not constitute an offer to sell any securities or represent an express or implied opinion or endorsement of any specific investment opportunity, offering, or issuer. Any discussion of performance or returns is not indicative of future results. Each individual investor situation is different, and any ideas provided may not be appropriate for your particular circumstances. Foundations only transacts business in the states where it is registered or is excluded or exempt from registration requirements. Registration as an investment advisor is not an endorsement of the firm by security regulators and does not mean the advisor has achieved a specific level of skill or ability. Legal services are offered by Eidelman Law Firm. Tax services offered by Market Tax Services. Market Advisory Group does not provide legal or tax advice. Investment advisory services are offered through Foundations Investment Advisors, LLC, an SEC-registered investment advisor.